Hello, everyone, and thank you for joining us today for the new Medicare Card updates and Social Security Disability Benefits Overview webinar. We will begin in just a few moments. On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Support webinar series. My name is Julie Cahoon, and I work for Kaufman and Associates. I will be the moderator for today's webinar. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window where you see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. A Q&A session will take place after each presentation. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you click on a link, it may pull up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You will receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on CMS.gov. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled New Medicare Card Updates and Social Security Disability Benefits Overview. We have two presenters with us today. We have Priya Helwig and Kirk Larson. Priya Helwig is an External Affairs Liaison in the Office of the Regional Administrator for the Center for Medicare and Medicaid Services in Region 10. Her primary responsibilities are to increase public awareness of CMS programs through outreach, education, and stakeholder relations. Priya joined CMS's central office in 2005 to provide outreach and training to American Indian and Alaska Native communities, support for the Tribal Technical Advisory Group, and has served as a subject matter expert for the Tribal Affairs Group. Kirk Larson is the Social Security Administration Public Affairs Representative for Alaska, Idaho, Oregon, and Washington. He has worked with the agency for over 25 years in both technical and supervisory roles. Kirk has presented Social Security information in Alaska, California, Idaho, Oregon, and Washington. He has had several articles published and has appeared on TV and radio shows to discuss Social Security topics. Thank you both for joining us today. I will now turn it over to Priya for a presentation about the new Medicare cards.
Thank you, Julie, and thank you all for inviting me to speak with you today. At the beginning of my slide. Okay. As Julie said, I work in the Region 10 office of the Centers for Medicare and Medicaid Services, and my primary role is partner relations, training, and education. So our states are Washington, Idaho, Alaska, and Oregon, but this presentation is national in focus. So I'm here today to talk to you about changes in the Medicare card. And CMS is removing the Social Security numbers from the Medicare cards to help people and protect their personal identities and prevent fraud. So this spring, we successfully began mailing the new cards with a new, unique, randomly generated set of alpha and numeric characters to first-time Medicare enrollees and to people who already have the Medicare card. The old number, or the HICN, as we like to call it, which is the health insurance claim number, has been replaced by the new Medicare beneficiary identifier, and the card has also been redesigned. So like the HICN, the Medicare beneficiary identifier is used for processing claims and determining eligibility. And to ensure that people with Medicare continue to get care, healthcare providers and suppliers can use either the former Social Security-based HICN number or the new MBI for Medicare transactions through December 31st, 2019. So, and it is important to note that the new Medicare numbers do not change the benefits. People with the Medicare card, they can start using it as soon as they get it. And what we really need is your help to give beneficiaries accurate information about what they can expect and what the card looks like so that we can continue to prevent fraud and abuse. So most consumers do perceive the removing of the Social Security number from the cards as pretty positive. And this slide is a comparison of the two cards. They also really still liked the red, white, and blue, so we kept that. The new card has the name of the beneficiary, the 11-digit MBI number, and the dates of Part A and B coverage. The old gender and signature fields, those have been removed. And the new card is smaller. It's wallet size, so it should fit more easily into a wallet. The cards will be bilingual, English and Spanish. And it is really important to note that the MBI has certain characteristics that you all should know to, again, identify if numbers become fraudulent. So you'll see in the blue box there's a comparison of the old HICN and the new MBI. In the new MBI, the digits for 2, 5, 8, and 9 placements will always be alphabetic and in uppercase. We also have excluded S, L, O, I, B, and Z. So you can see that this, if you had a card come through that did not have these characteristics, it is not an accurate card. And we do find that sometimes beneficiaries are a little concerned that they're getting a new card and a new number and they can't remember it because they always knew how to remember their Social Security number with the old HICN number, but they really don't need to remember their Medicare number. I always think, well, I don't know my insurance card number, so it's really fine if they don't know their new MBI. We can assure them that that's fine. However, scammers might play on this fear and try and offer to get them a new number. But keep in mind they cannot. All the numbers are randomly generated, 11-digit numbers. So nobody should be offering to change a beneficiary's number or ask for a fee to get a new card. And again, let's see, none of these items removed from the card are needed to obtain Medicare services. So remember, benefits do stay the same, and the beneficiary can use both old and new cards until December 31st, 2019. So people who are new to Medicare and enroll after April 2018, so this year in April, received the new Medicare ID number, and they never received the old HICN card. You might have to remind consumers that their Social Security card has not changed, and they should keep that card safe. Do not destroy the Social Security card. There's been a little confusion about that. It is only the old Medicare card that should be destroyed. In addition, the new Medicare card with the new number, they should hold on to, cards that they received from their Medigap plan and other prescription drug plans. Again, those are still effective and they should be using those. The new Medicare card does not replace those. So all existing Medicare card holders will receive a new card with the new number by April 2019. Once they receive that card, they can take it with them to their provider right away. and they should destroy or shred the old card. Beginning January 1st, 2020, only the new Medicare cards and new numbers will be used. So we are relying very heavily on providers and partners and consumer advocates to, again, protect from fraud. And please encourage them to not share their new Medicare card with anyone. This is a good opportunity for people who don't mean well to contact beneficiaries. We really want to make sure that they are protected. They should treat this new card kind of like a credit card, but not carry it everywhere. They should keep it safe. Scam artists may try and get personal information by contacting the consumers, and you should please let consumers know to hang up right away if someone asks them for any of the card information or for money or threatens to cancel their benefits if they don't share their personal information. And people who believe that they are victims of identity theft or Medicare fraud will be able to get a new Medicare card with a different number by contacting 1-800-MEDICARE. Okay. I'm getting a blank screen. Can you still see the slides, Julie?
Yes.
Okay, my screen is blank, so I can't see the slides. I'm on sending new Medicare cards.
Okay.
So I'm just going to say new slide when I get to the new one, if that's okay. Can you advance them?
Of course.
Thank you. So we're in the sending new Medicare slide, and CMS began, like I said, mailing cards this year in April, and it's worth noting that consumers who retired from the railroad will get a card mailed to them by the Railroad Retirement Board. CMS mails cards based on the address of record at the Social Security Administration. So consumers need to make sure that their address is up to date, and they can do that by calling SSA's toll-free number or logging into my Social Security account or going at SSDI.gov/my-account, or they can visit the local Social Security office. The cards were mailed randomly by geographic location, which means they were not mailed to one general area at the same time. So neighborhoods or even household members would not necessarily get their cards at the same time as their neighbor or another Medicare beneficiary in their house. So consumers might be concerned about this, and you can let them know the cards were mailed randomly, and they should hold on till the mailing is complete. Consumers can go to Medicare.gov/NewCard for more information, and they can sign up to be notified when the mailings occur in their state. So next slide, Julie, this is the one with the map. Oh, great, I can see that now. This is the Medicare.gov/NewCard gives an overview of the ways CMS is strategically mailing the new cards. So you can see the waves on the table, where we have mailed, where we're currently mailing, and future mailings on the map. So not many states are left for future mailings. We're finishing up 5 and 6 right now. If their wave has been completed, if the beneficiary sees that their mailing has been complete and they did not receive their card, they should call 1-800-MEDICARE. There might be something that needs to be corrected or updated in their mailing address. Also, if they have questions and don't receive their card by April 2019, it's a good time to call. And you can see by the map that soon we'll be mailing to Kentucky, Louisiana, Michigan, Mississippi, Missouri, Ohio, Tennessee, Puerto Rico, and the U.S. Virgin Islands. That's next on the list for October. Currently, we're mailing in the blue areas. Let's see if I can advance this. Yep. Okay, wonderful. So signing into MyMedicare.gov allows the consumer to see their card's mailing status and print an official duplicate card. So if the mailing wave has been completed and they, for some reason, need a duplicate card, they can actually print it from the MyMedicare page. They will need to create an account, however, if they don't already have one. And at www.cms.gov is where you all can go to access materials and see examples of the mailings. So we have lots of posters and printouts, examples, social media, videos, things that you might need and could use to help educate beneficiaries about the new cards. And this is an example of the letter that they're receiving, and you can show them this letter and let them know that it is important for them to open their mail, and if they get this card in the mail, to hold on to it. These are two examples of some of the outreach materials we have. They're pretty much they're very easy, they're colorful, and you can tack them up in a waiting area or any place where beneficiaries might gather. And then finally, this is a list of the websites that I did mention, and I believe you're going to get a copy of these slides. And you'll notice the product ordering at cms.hhs.gov. You can get to that also through the cms.gov website. And that concludes my presentation. I'm happy to take questions.
If you have a question for Priya, you can type in a question using the Q&A pod. So we have a question has come up. The question is, are the new cards plastic or durable?
No,
if not, can they be laminated?
They are paper, and they can be laminated. However, keep in mind that the doctor's office might want to scan the card or have another mechanism to duplicate the card for their records, and if they are laminated, that might pose a problem. But otherwise, certainly, folks are able to laminate the card, and it is still paper.
Okay, another question has come in. Is there a way to tell the difference between RR Medicare and Medicare by HICN?
I don't think so. I think it is the same number, but I can double check that.
Okay, again, if you have questions for Priya, you can enter those in the Q&A pod located at the bottom right side of your screen. Okay, at this time we have no further questions. If you do have a question that comes up during the next presentation, we can take questions at the end of the next presentation as well. And with that, Kirk, if you would like to go ahead and begin with your presentation.
All right. Well, thank you so much. And Priya, thank you for that information. I think that's very helpful, very important to understand those Medicare cards and when they're arriving, and try to prevent as much confusion as possible. We want to eliminate that at all opportunities. Well, thank you, everybody, for coming to the presentation today. My name is Kirk Larson, and I do work for the Social Security Administration. And today, we're going to be focusing in on disability benefits. Now, before we jump into disability benefits, there are a few things I wanted to discuss. First off, just want to remind you, if you do have a question as we're going through the presentation today, please type it in. We'll have some time at the end to answer those questions, so I do like taking questions as we go through. The first thing I want to start off with, though, is the My Social Security account. This is important for both you as an individual, because I'm assuming that all of you want to learn about your benefits as well. You know, will you be able to retire someday? Will you be able to collect disability benefits? Are your survivors protected with survivors benefits? Yeah. So if you want to understand your individual benefits, you need to open up a My Social Security account. Or if you're working with clients and they want to understand their benefits or they want to manage their benefits, they also need to open up a My Social Security account. By having access to the individualized My Social Security account, a number of different things you can do. First off, you can look at your Social Security statement. and you can see what your future benefits are going to be. You can also review your work history year by year to ensure that you get all the credit for all the work that you've done over your lifetime. Also, by having this account, in many states, not all states, but many states, you can actually request a replacement Social Security card. Now, our intention is to roll this out to all states, but at this point, not all states have this option. We have to make agreements with state governments in order to allow this to happen. But in most states, you can actually get a replacement Social Security card by having a My Social Security account. You don't have to go into an office. Or if you file for benefits online, you can check the status of your application online by having a My Social Security account. Or if you need to get a benefit verification letter, you need proof of how much you're getting from Social Security. If you or a client have this My Social Security account, they can print up the benefit verification letter anytime they need it. Or if they're getting benefits and they need to get to change their address, change their phone number, change their direct deposit, they can do that anytime that they need to. Or if they need to get replacement tax documents, or if you need to get a replacement Medicare card. If you need to get a replacement card, yours is lost or damaged, you can request a new Medicare card using the My Social Security account. So very important that people have access to this information so that they can prepare for the future, understand what their benefits are going to be in the future, or if they're getting benefits, they can manage their benefits right online. They don't have to go into an office. They don't have to call us. Now then, I want to go ahead and jump in and talk about Social Security disability benefits. Now then, you may know, or you may not know, that Social Security actually administrates two different disability programs. One of them is called Social Security Disability. That program is based on your work and how much you paid into the program. And we have a second program called Supplemental Security Income Disability, or you might hear this referred to as SSDI, or Supplemental Security Income Disability. Both of these programs are administered by Social Security, but the benefits they'll pay and how you qualify for these programs are very different. Wanted to explore the differences between the two programs, so as you talk to people and someone says they're on disability, you can kind of help identify what program they might be on. Social Security disability insurance, this is for payments come from the Social Security trust funds and are based on a person's earnings. So benefits from the Social Security disability insurance can be as little as $200 a month on up to $2,800 per month. The Supplemental Security Income Program, on the other hand, the money to fund that program does not come from the money that people pay in by working. The money for this program comes from the general trust funds. The Social Security Disability Program, an insurance that workers earn by paying Social Security taxes on their wages over time. Note that this can be lost. What I mean by that is Social Security Disability has some requirements, and in order to be eligible for that program, you have to have worked a certain amount of time. So not everybody is eligible for this program, and there are times when you could be insured for regular retirement benefits, but you may not have worked enough or long enough or recently enough, and you might not qualify for your regular Social Security disability benefits. SSI, on the other hand, it's a needs-based public assistance program that does not require a person to have worked. So you may never have worked, and you might qualify for this needs-based assistance program. Social Security disability pays benefits to disabled individuals who are unable to work regardless of their income and resources. Doesn't matter. If you've worked and you have $1 million sitting in the bank, you could still qualify for this program. It's all based on the work that you have done. The SSI program, on the other hand, pays disabled individuals who are unable to work and have limited income and resources. So the key there with this program is you need to be disabled and you have to have limited income and resources. For the regular Social Security disability benefits, benefits for workers must meet insured status requirements. As we discussed, you have to have worked long enough and have worked a certain number of credits, meaning in order to be eligible for this program, you have to have a certain amount of work. For the SSI program, you could be a child or an adult, maybe you've never worked or you have very limited work, and you potentially can qualify for this program if you have limited income and limited resources. So two very different disability programs, both of them are administered by Social Security. Now then, one thing that these two programs do share in common is a definition of what it is to be disabled as an adult. So I'm going to walk through this with you. You must have a physical or mental impairment or a combination of conditions. So in order to be eligible for this program, you need to be disabled. And that could be a mental disability, or that could be physical, or it could be a combination thereof. Also, to be eligible for these programs, you have to have the inability to perform substantial work activity, or what may be referred to as SGA. Now then, what our doctors basically look for in this situation, does your condition limit you to making under $1,180? So that's basically the standard that we're looking for. With your disability, could you still return to work and do something and make $1,180? If the answer is yes, you could still do that, then you're not disabled for Social Security purposes. Now then, note for blindness, if your disability is blindness, the work level is actually higher. It's $1,970. But for regular disability, are you able to go out and make $1,180 a month doing something? Also, disability must be expected to last 12 consecutive months or will result in your death before the end of that 12-month period. So this is a very serious condition that we're looking at, not a temporary, short-term type disability, but something that's very serious. Now, I'll give you an example of this 12-month concept. If you got in an accident yesterday and you broke both your arms and both your legs, you are 100% disabled today. However, you are likely to be denied Social Security disability benefits because your doctor would need to say, because the person is disabled today, I expect that they're going to be disabled 12 months from now. Doctors are usually fairly conservative about that. They don't like to look at information and say, this is what's wrong with you today, therefore I know you're going to be unable to work for the next 12 months. They're very good about saying what's wrong with you now, but they're very conservative about saying, therefore it's going to prevent you from working for some time. So in order to be eligible for benefits, you do need to get that from the doctor. The condition you have needs to be severe and expected to last at least 12 consecutive months. Or it's already lasted 12 consecutive months. So if you file for benefits and you stopped work 12 months ago, and now you're filing today, we're going to say 12 months have already gone by. You've already demonstrated that you've been disabled for 12 months because you haven't worked. Also, I do like to point out when I talk about work, remember, you have to be disabled, you have to be unable to make $1,180. Therefore, if you're still working, but because of your disabling condition, you're making under $1,180, you're still considered to be disabled. So it's a myth that you need to actually stop work altogether in order to file for Social Security disability benefits or for our SSI program. You just have to be under the $1,180. So if you filed for benefits and you were making $1,000 per month because of your disability, you couldn't make any more than that, you can still file for Social Security disability benefits. So don't let that stop you. You can still go ahead and file for benefits. Last thing, when we look at to see if you are disabled, we're going to take into consideration your age, education, and past work experience to see if there's some sort of substantial work that you could return to. Now then, I often get the question, when should I apply for disability benefits? You should apply as soon as you become disabled and you know that your condition is going to prevent you from working for at least 12 months. Processing an application for disability benefits can take 3 to 5 months. So you don't want to wait for 12 months to go by. You want to file as soon as you know that you're going to be disabled and out of work for a extended period of time. We may be able to process your application faster if you help us by getting information we need. Meaning, when you file for disability benefits, if you can provide us with any medical documents, that will help speed up the case. Now then, a couple of hints. If you're helping someone file for disability benefits, you want to give us everything that prevents that person from working. Meaning, if their major disability is a back injury, you still want to tell us about all the other things that limit their ability to work, including if they have some sort of eyesight problem, they wear glasses, or they're colorblind, or anything else that might limit their ability to work. We need to know about that because typically people are not approved for one single item. They're usually approved for a combination of disabling conditions that prevent them from working. So when you're helping someone fill out paperwork or complete their application online, you want to list every single thing that prevents them from working. Also, you need to provide to us medical information where we can get the proof that they are disabled and unable to work. So we need to have their doctors and hospitals, the doctors' names, hospitals' names, addresses, dates that they would have been there, so that we can right away and get that information. However, if you have any medical evidence and you can submit that with the application, that will speed up the process. How do I apply for disability benefits? Very simple. Most applications can be done online. And almost all the medical evidence can be provided online. Now, there are times if you're filing for our needs-based SSI program that you'll also need to have a phone interview. But much of the application, a lot of the information, particularly all the medical information, can be provided online. You can complete the medical portion of the applications right online. And for many applications, you can complete the entire process right online. You can also call our 800 number, that's 800-772-1213, and schedule an appointment with our local office. And we can do that generally by phone, so you don't have to travel to the office. If you want to, you can. But most applications we can do right by phone. Now then, once you file the application and you're filing for the regular Social Security disability insurance, what will happen next? Your application will be reviewed to make sure you meet some basic requirements for disability, meaning that we're going to need your name, date of birth, Social Security number, date of birth, different information like that. We'll check whether you've worked long enough and enough years to qualify and evaluate any current work activities. Meaning, like I said, we generally when you become disabled, we're going to look backwards 10 years. And in that 10-year period, you need to have worked the equivalent of 5 years in order to be qualified for benefits. Now then, when I say work for 5 years, this isn't a lot of money. If you made about, in today's terms, about $5,200, that's a year's worth of work for this particular test to see if you qualify for benefits. So we're not talking about a great deal of work in order to qualify. Also, if you're under the age of 31, we're not going to be looking backwards over the 10 years to see if you've worked long enough. As you go under the age of 31, we'll be looking at a smaller amount of time, all the way down to if you're 18 years old and you've worked and you've become disabled, you only need the equivalent of about a year and a half worth of work in order to become insured. Also, we're going to evaluate your current work activities. Like I said, you don't have to stop work if you're filing for Social Security Disability or our SSI program. You just need to be under the $1,180. So if you come in, you're still working, we're going to need to determine what work level you're at. After that, if you meet those requirements, we'll forward your case to the Disability Determination Service Office in your state. So we have doctors that are contracted in all the different states that actually do the reviews for us to determine if a person is disabled. These individuals do not work for Social Security or the federal government. They work for state governments, so there's no conflict of interest there. If you're filing for our needs-based benefit and you've completed the application online or you're doing an application in the office, we're going to start off, we're going to review your income. What monies do you receive? Are you currently working? How much are you getting? We're going to review your income to see if you qualify for this needs-based benefit. Also, we're going to look at your resources. Like I said, for this program, you need to have limited income, but you also have to have limited resources, meaning that when you file for this, we're going to ask a lot of questions about your income and resources. So we're going to need to get information about real estate you might own, bank accounts, cash, stocks, bonds, things that you could use as a resource. If you have low income and low resources, we'll then go ahead and send your application off to the Disability Determination Service Center to evaluate your case for disability purposes. This is a diagram basically of the basic disability life cycle about what's going to happen once we send it to our doctors. Here we are at the very beginning of this, at the top left-hand corner, currently performing SGA. Are you working too much? If you come into the office and you're making over the $1,180, we're going to have to evaluate that. And in many cases, you will not be able to file for disability benefits. We won't even forward it to our doctors to do a medical evaluation. So if the answer is yes, you are working above the SGA level, your case would be denied. If the answer is no, we'll send it forward to our doctors, and they're going to first see, do you have a severe impairment? Do you have something that's expected to last at least 12 months? If the answer is no, you would be denied there. If the answer is yes, then we're going to look up your one major condition that you might have. And does that condition meet or equal the listings? The listing is called the Blue Book. This is a large medical book that has all kinds of disabling conditions in it, broken down into basically 12 categories. We look through this book, and let's say you said your disabling condition was stage 4 cancer. We'll look through this book, we'll look up how severe that condition is, and then we'll look at your medical records and see if you meet that particular one item. Like I said, most people are not approved for one item. It's usually a combination of conditions. So if you have one condition that shows that you're disabled and you have all the requirements for that, advanced Parkinson's disease, for example, we look at the big Blue Book. If you meet all the criteria to have advanced Parkinson's disease, we can approve you right there. We do not need to move forward. Now then, the majority of people are not approved here. It has to actually go to the next step. So the answer is no. Then we're going to review your past work. This is usually where our doctors will contact you and say, we now need to get information about your past work activities. And we need to evaluate your physical abilities. How much can you stand, walk, sit, lift, different things like that. We're also going to need to review your prior 15-year work history. We need to know what type of work you did. And then they're going to evaluate that. Does the job that you performed, can you still do the requirements of that require physical elements such as standing, walking, sitting, lifting, things like that? If the answer is yes, you could still return to your past work, then you are denied. If the answer is no, they're going to look at it. Are there other types of work that you might be able to do that you're qualified for? If the answer is yes, then you're denied there. If the answer is no, your benefits are allowed. The doctors return the case to Social Security, and we contact you, let you know how much your benefits are going to be, and set you up for payment. Now, the basic payment for regular SSI, or our needs-based benefit, is $750 per month for an individual, or $1,225 a month for a married couple filing jointly. Those are the base dollar amounts. Now, that's for our needs-based benefit. These typically do go up a little bit each year. Our Social Security benefits, like I said, could be anywhere from as little as $200 per month, for example, on up to $2,800 per month. As I indicated earlier, when we're evaluating you for the SSI needs-based benefit, we're going to look at your resources. If you as an individual have over $2,000 in resources, you will not qualify for this program. If you're a married couple filing jointly and you have over $3,000 in resources, you will not qualify for this program. Now then, things that we look at, we're going to look at your bank accounts, CDs, IRAs, monies that you have in a bank. We're going to look at more than your primary automobile. We will typically exclude your primary automobile or your primary form of transportation. We're also going to look at your stocks, bonds, 401ks, pensions, other different items that you own, liquid assets, property other than where you live. Now then, we will typically exclude the home that you live in. Some of the things we'll exclude from what are benefits: the home in which you live, your primary automobile or your primary form of transportation, burial plots, and certain resources set aside for personal burial expenses. If you have money set aside for burial purposes, we can exclude those monies as well, up to a certain limit. I'm not able to see the screens at this time. Are you still able to see the screens?
Yes.
Okay. Which screen are we on?
Slide 32. What is income for SSI?
Oh, very good. So the income for SSI oops, let me get back to that screen. Hold on. So there are typically 4 types of income that we're going to look at here. This gets a little bit confusing. As I'm going through this, obviously we are not going to make you experts on the disability benefits in a 40-minute presentation. Just want to familiarize you with some different things. So for income, we look at basically 4 types of income. We're going to look at earned income. Are you working? And if you are, how much money is coming in? We're also going to look at your unearned income. Are you getting money from some sort of pension or regular Social Security benefit, state disability, unemployment? Are you getting any type of income? So is anybody giving you money? That would be considered to be unearned income. Then we have the concept of in-kind income. Is anybody giving you these things? Is anybody giving you food, or is anybody providing you shelter? That can lower the value that you're going to get from our needs-based benefit. The 4th type of income that we're going to look at is deemed income. If you are an adult and you're married, does your spouse bring in any income? We're going to look at the value of that. The idea here being is that your spouse, some of their income will go to your support. Also, if you're a child, we're going to look at the income of your parents. The idea being that your parents are providing you support as well. So these are the 4 basic type of concepts that we look at for income. So it's not just money that you might be working, but we also look at income that someone might be giving you. We look at the in-kind income. Is someone providing you with food or shelter? Like I said, this program, and this is for SSI, our needs-based benefit only. Regular Social Security, don't get this confused. Regular Social Security, we don't care about these things. We don't care about your income and assets. We do care about it for our needs-based benefit. Now then, as we discussed earlier, that definition that we look at for disabled, that was dealing with adults, but also like to remind you that children can also file for our needs-based benefit. If the child is age 18 or is under the age of 22 and is a student regularly attending school. These are children that can file for benefits. The SSI requirement for children. If under age 18, the child has a physical or mental impairment or combination that results in marked or severe limitation in functioning. As opposed to the adult disability, we're not looking at the child's ability to work. We're looking at their ability to function at the normal level of their age. So it's a very different definition of what it is to be disabled. The child must either be blind or disabled. If the child is blind, he or she must meet the same definition of blind as applies to an adult. So if you're visually impaired, you'd have to meet the same standard that an adult would, not necessarily for work level, but the same definition of what it is to be visually impaired. Condition must be expected to last 12 months or result in death before the end of the 12-month period. So that doesn't change compared to the adult definition, but the concept of marked or severe limitation in functioning is a very different concept for children as opposed for adults. SSI requirement for children: disabled child living in a household with limited income and limited resources may be eligible to receive SSI benefits. For eligibility, the income and assets of the disabled child's parents living in the household with that child are taken into consideration. So if a child is getting income or just living with their parents, we're going to take into account the parent's income when seeing if the individual is eligible. So some different incomes that could be child support, Social Security payments, gifts, other different things like that could be considered income. And of course, if the parents are working, some of that income from the parents' work would also be considered going to the support of the child. Now then, if you file for disability benefits, or if a child files for disability benefits, and you disagree with the decision, you're denied benefits, you have the right to appeal. Typically, you will have 60 days to file an appeal. Now then, there are multiple levels of appeal. The two typical ones are reconsideration level. If you're denied for the first time, it goes to the reconsideration level, and we review your case there. Not all states have that. Some states go directly to our administrative law judge. They actually skip the first level of review and actually go to the administrative law judge. Now then, at each one of these levels, you would have a 60-day time period to file an appeal. When you file the appeal, just a reminder, you want to include any new evidence that you might have to support your claim of being disabled. Sometimes, maybe 3 to 6 months have gone by since the last decision was made. You'd want to supply us with any new or material evidence that may have occurred during that time, or any other evidence that may not have been considered before. Perhaps you had given us 2 doctors in the first application, but there was a 3rd doctor that should have been included, and we didn't get that information. You can now include that information, or if anything has occurred since you initially filed, you can include that new information as well. So encourage people, if they are denied benefits and they still believe they are disabled, they should file that appeal as soon as possible. Do not wait the 60 days. While you have 60 days, it's best to get that information in as soon as possible, and any new evidence that you might have should be supplied with that appeal. Now then, if you want to get more information about our disability program, I encourage you to visit our website. That's at www.socialsecurity.gov. There, wealth of information you can get about all of our programs. Of course, here we are on our first screen. You can find out information about retirement benefits, disability benefits. If you were to click on the disability icon, that would take you to a location where you could go ahead and find out the different definitions or review some of the information, for example, that I gave today for the requirements to file for these programs. Also, another unique part of this screen here, you'll see down here in the lower right-hand corner, frequently asked questions. This is a great section. You can go there, type in disability or SSI, and it'll bring up the most frequently asked questions about these programs. So you might get 20 or 30 questions that have been asked in the past, and they might be the same questions that you had as well. We also have a special page at socialsecurity.gov for American Indians and Alaskan Natives. This is great information. You can come here. You can get more information about Social Security issues, also special issues that apply specifically to American Indians and Alaskan Natives. Also from this page, you can pull up a special booklet called a Tribal Benefits Guide. This is a great guide, particularly if you work with Native populations. You want to go ahead and find out information that is pertinent to them, and it also reviews all of our programs, retirement, survivors, disability benefits. This is a great guide to have available to you. So I encourage you to visit our website, but also please stop by and take a look at our page for American Indians and Alaskan Natives. All right, well, we have some time left. I really do hope that some questions came in and I can answer those for you. Do we have any additional questions on anything that we've covered?
Yes, there have, throughout the presentation, a number of questions have come through the queue. So I will go ahead and start asking those questions. And again, just if you have a question for either presenter, you can go ahead and type that in at the Q&A pod located at the bottom right side of your screen, and we'll go ahead and use the remaining time to respond to questions. The first question is for you, Kirk. Are there asset limits if someone currently receives disability benefits?
There are asset limits if they're on our SSI needs-based benefit. The answer is yes. For an individual, that's $2,000. For a married couple filing jointly, that's $3,000. And for a child living with two parents, the asset limit for the family would be $5,000. So yes, there are asset limits. If somebody was getting the SSI benefits, Supplemental Security Income Disability, and they went over their asset limits, let's say they got a certain amount of money coming in, and now at the beginning of their month, they had $3,000 sitting in their bank account. Basically, their payment for that month would be suspended. Now then, if by the first of the following month, their benefits were under $2,000, they had $1,800 in their bank account, and they didn't have other assets or other incomes that would prevent them from being eligible, they can now become eligible again and receive payments. So if you go over the asset limit and you're getting a check, that doesn't mean you're terminated. That just means you're suspended for as long as you're over the asset limit.
Okay, great. So our next question is, if a child is disabled, can they receive Social Security benefits if the parents are gainfully employed, i.e. the family would not qualify for SSI? So does the child have to wait until 18 years old to receive disability benefits?
So as long as the child is living with their parents and their parents are gainfully employed, meaning that there's money coming into the household through their employment, depending on the level of that money, let's say the parents are getting $40,000 a month. There's two parents in the household, $40,000 a year, not $40,000 a month. $40,000 a year. There's two parents in the household. There's one child. That one child is disabled. And yes, in that situation, the child would not be eligible for the needs-based benefit, not because they may be disabled, but they're not eligible for the needs-based SSI payment. Now then, when the child reaches the age of 18, they technically become an adult, and they could file for our needs-based benefit at that time. Now then, they won't be judged. They won't have the definition of what it is to be disabled as a child, that marked and severe functioning definition. We're going to look at their ability to work at age 18. Now then, if they're even still living with their parents, and their parents are giving them food and shelter, they can still file for that needs-based benefit at age 18. Because now we're not going to consider the income and assets of the parents to see if this 18-year-old individual is meeting the requirements for the needs-based benefit.
Okay, thank you. Our next question is, are persons who are approved for SSDI and SSI certified for life or only for a certain amount of time? How often are disabled persons' benefits reviewed?
Very good question. We periodically will review people for medical issues. It depends on how severe your condition is. If we consider that it's very likely that you're going to approve, we might request that a review be done in 1 year. If it's possible that you're going to review, we may request a medical review in 3 years. If it's somewhat unlikely that you're going to review, we still need to do a review, but we typically will push it 5 or 7 years out to do those medical reviews. So when you're approved for benefits, we automatically set up what we call a medical diary. And when that matures, basically the computer would send a letter out to you saying, you have now been on benefits for 36 months. We are now going to review your condition. We need to gather information regarding your medical contacts, and we'll review to see if you are still disabled. So that's typically what will happen, and that happens at the initiation of when the person is approved. We create that medical review time period. So it varies from person to person, depending on the severity of their condition.
Okay, great. The next question is related to age and education. Can you specify what considerations are being thought about in regard to age and education?
I'm not sure of the context of that particular question. I'm not sure how that relates. You may want to go on to another question.
Sure. So the next question, if filing for children with medical/complex health needs, can SSI application be filled out online? And if a child has a possible compassion allowance medical condition, how is that identified on the application?
Okay. In those situations, first off, I'll talk about the compassionate allowance aspect of it. We do have on our website a list of very serious medical conditions that we can find out that we can allow you for much quicker than most. Typically, when you complete the application, we'll type the information into the computer. When we submit the application to our doctors, before it even reaches the doctors, a computer program will review all of the information. And it's looking for key words, advanced Parkinson's disease, late-stage cancer, things like that. If the computer detects that language, it will actually move it to a different group of doctors who can make a decision much quicker. Now, I would recommend in those cases that you probably not do the application online. You probably want to call the 800 number, get appointments scheduled, and you can do the application over the phone with the office. The child obviously does not need to. It can be done by the child's parents, can do the interview over the phone to see if they can get approved. Now then, we are going to still need to review the income and resources of the parents and the family to see if the child will qualify. But in those type of situations, we want to get that done as quick as possible. So if you have somebody that might have a very serious condition, you can review online at our website the compassionate allowances. And if you have one of those conditions, often you can be approved for benefits in as little as 2 weeks.
Okay, great. Our next question is there an income template that can be used for eligibility determination?
The eligibility determination for income is extremely complex. In the past, we have had some very basic templates that people could use, but this is such a complex matter because it changes. Is there one parent in the household? Are there two parents in the household? Is there one disabled child, two disabled children? Are there other non-disabled children that are in the household? This can affect the amount of income that the household can have. Meaning if you had one disabled child and two parents, and those parents were making $40,000 a month, normally the child wouldn't, $40,000 a year, normally the child would not be eligible for benefits. However, if there are two other non-disabled children in the household, the numbers change, and that child might be eligible for our needs-based benefit. So we have typically encouraged people to go ahead, if you have a disabled child, go ahead and file the application. Go ahead and contact us, set up the interview, and we can go ahead and make that call. Now obviously if there's one child and there's someone's making $80,000 a year, they're not going to be eligible for the benefits. But if it's relatively close and there's multiple people in the household, you should really file the application and let us make the determination about income questions.
Okay, so we have enough time for just a couple more questions. There was one question that came in for Priya. Priya, in regards to the new Medicare cards, are the numbers the only thing that changed on the cards?
No, if you go back to the comparison slide, there are two, the layout of the slide, the size of the slide, and the information on the slide is pretty much overhauled completely. So no, the numbers are not the only thing that has changed. And I also did look up the Railroad Board numbers, and it's the same as the HCN number. It's just that the Railroad Board will be mailing those, I think it's 45,000 applications for folks that receive their benefits.
Okay, great. And Kirk, sorry.
Yeah, if you look at the what does the new Medicare card look like slide, I think you have it up, right? Yeah. So it gives you a comparison. Were there specific questions around that?
There were none that had come in. And we'll go ahead and take one more question, and this one will be for Kirk. Kirk, the most common question that this participant receives is in regard to SSDI is, can a person collect both SSRE and SSDI if they become disabled and can't work?
I'm sorry, so SSRE, was that the term?
The question is, the most common question that this person gets regarding SSDI is, can a person collect both SSRE and SSDI if the person is disabled and can't work?
I'm not sure what SSRE is.
That would be the retirement.
Oh, okay. So can a person, a person that's over the age of 62 be eligible for retirement benefits and disability benefits? Is that the question? In that situation, if you're collecting Social Security disability benefits, you're basically collecting 100% of your payment already. There are no retirement benefits that you would receive in that situation. If you're collecting disability benefits and you reach your full retirement age, currently for most people that's age 66 or age 67, we simply convert you from disability to full retirement. The dollar amount of your check does not change. But this does bring up an interesting question. Can someone receive regular Social Security disability benefits and benefits from our SSI program? And the answer there is yes. At times, you will have people collecting from two different programs. Maybe you have somebody that's 62 years old, they're getting regular Social Security disability benefits, or maybe they're getting retirement benefits, and that benefit is very low. Remember, the SSI program, our needs-based benefit, will pay you $750 per month. If you're only getting $500, let's say, from Social Security retirement or Social Security disability benefits, you could also then file and get some additional monies from our needs-based benefit. It would be about $250. You subtract out that dollar amount out of the SSI payment. So you will have people that are collecting both Social Security benefits and SSI benefits. One last thing I want to say here. Of course, we threw a lot of information at you for this. If your tribe or your group would like to have a presentation about Social Security benefits, we are always available to go ahead and do that. If you want to contact us by going to our website and just go to the search function and type in request a speaker, we can make somebody available to you that will be happy to either come out directly or possibly do a telephone presentation and talk to you, your staff, tribal members, about all of our programs, retirement, survivors, disability benefits, so that you can learn in more detail, if necessary, about all of our programs and the ways that you can file for it. Any other final questions?
At this time, we have capped on our time frame, so I would like to go ahead and thank Priya and Kirk for joining us today and sharing information about the new Medicare cards and Social Security programs. We can send out a thank you reminder to folks outlining some of the resources that were referenced in this presentation. In closing, I'd like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at CMS.gov on the Tribal LTSS Technical Assistance Center website on CMS.gov. Thank you again for joining today's webinar. Our session is now concluded.